let's turn to a provocative positive trial that may or may not have clinical implications for us. LUNAR was a study of generally second-line treatment for patients with advanced non-small cell lung cancer, any histology, where you got systemic treatment with or without tumor treating fields. Now, this is something completely different. This is not another infusional therapy. This is essentially electric transducers applied to a person's chest. And they wear this with a battery pack that essentially puts out an electrical field across the chest and over the area where the disease is. And the concept is that this causes some DNA damage that can help facilitate immune activity against the cancer. In this particular trial, 276 patients were enrolled. It was a global study. Half the patients had received Taxotere, Docetaxel-based treatment, which is what we tend to use in the US. Half the patients had received immunotherapy as their second-line treatment after having gotten chemotherapy alone, which is done in some parts of the world, or at least was. It's less and less the first-line treatment approach, but that was what was done. We learned from a press release that this was positive for the primary endpoint of overall survival, which we never take for granted. That really makes it worth our notice. It was one of the oral presentations at ASCO. When we saw the results, you can see that there is a median improvement in overall survival of about 3 months for the entire group. It's about an 11% improvement in 1-year survival, 11% improvement in 3-year survival with the tumor treating fields added to the systemic therapy in question. However, when you look at the actual results based on the treatment that people got this with, the benefit was clearly more in patients who had received immunotherapy with their tumor treating fields, where you have about a 37% improvement in overall survival with the tumor treating fields added to immunotherapy. A much more of a separation of these curves, suggesting this improvement over time. Not much of an improvement with tumor treating fields added to Taxotere. And as I mentioned, Taxotere would be the standard of care backbone of our treatment approach for previously treated patients in the US, and I would venture to say most of Europe as well. So really a question of whether this is a clinically significant change for the patients compared to what we do now, which is largely Taxotere, docetaxel, more than immunotherapy. We always have to weigh also the downsides, the challenges. The main side effect here is dermatitis, a rash, which is usually mild to moderate. That was seen in 43% of patients. There's also just the challenge of this is a treatment, a rather cumbersome apparatus that has to be worn on your chest. You have to carry around the battery pack to power it most of the vast majority of the waking day. So it doesn't necessarily have easily measurable challenges, but there are burdens to implementation. So with that, I'd just love to get your opinions on whether you see this as a real change in treatment that you're going to recommend for your own patients, or a much more limited value, maybe even questionable value. Maybe, Alfredo, can I start with you on what you see coming from this?
Yeah, thank you very much. I don't think this is the classical example of a positive study that, in my opinion, should not change anybody's practice. Let's be very honest. So this is a study that has suffered from many issues. One was the long-lasting recruitment, where change in standard of care in second line. Therefore, there's a high risk of, it's a very heterogeneous, a lot of imbalance in prognostic factor that might have impact on the final results. if you look at the activity, so response rate pretty much was the same. So, and progression-free survival also wasn't different. So I don't think that this study should change anybody's practice. Practice has already changed. And so interesting, maybe to explore furthermore, but I don't think it will definitely will have an impact in my practice for sure. I think it was just I could call it statistical fluke, maybe. That's what I would probably call it. At least this is my take.
I mean, I think that they would make the argument, which may be more with the benefit of hindsight, that immunotherapy could be particularly synergistic with it, maybe. But I think practically, this is what we have. And, immunotherapy is overwhelmingly used in the first line setting, docetaxel with or without other things in the second line. Christine, what do you take from this? And are you now going to recommend this to many of your patients? And, how do you see it being taken up?
Yeah, I mean, I think it's really interesting and innovative. They're thinking outside the box, and we need outside the box treatments for lung cancer and all cancers. But this, I agree with Alfredo. I'm not really sure how to position this in my current practice when it becomes more widely available. And I think it's also like many other things. Is it convenient for the patients, and how do they? I'd like to see more studies about how the patients felt with this device on, and understand the quality of life with this particular device. That it would have to be that also would factor into my decision making in terms of utilization of this this apparatus for my patients. And so, again, I think push for innovation. I really applaud the company for being innovative. How I'm going to use this right now, I'm not really sure.
Okay, well, I think that's going to be a general consensus. I mean, I think what you're saying is more similar than different. It's there's some encouraging threads here, but practically, I think we'd scratch our heads. I personally think when I may well talk to patients about this, but I think they would look back at me and say, "You want me to what? Or what would this be?" And might not be very enthusiastically favored.